Good evening. I'm Terry Sege. Welcome to the Leaders' Debate on Healthcare. This debate was set up by CUPE Local 1252, which represents more than 9,000 healthcare system workers in New Brunswick. They are clerical, stenographic, and office equipment operations. They are institutional services workers. They perform patient services working within the Vitalite and Horizon Health Networks and Ambulance New Brunswick. Now, they care about the healthcare system not only because they work in the system, but they also use it. The state of New Brunswick's healthcare system and how it meets or doesn't meet the needs of New Brunswickers is a huge public policy issue. And tonight, we want to hear what the leaders of the parties in the New Brunswick legislature have planned for our healthcare system. So this is a public policy discussion. Now, you should know that the leaders of the three parties in the legislature were invited to take part in tonight's discussion. Liberal leader Susan Holt is here tonight. So is Green Party leader David Kuhn. The leader of the Progressive Conservative Party, Blaine Higgs, declined our invitation to take part. Welcome to you both. Thank you for being here.
Good evening.
Thanks, Terry.
It seems like we've done this before, haven't we?
I think we may have.
Nice to have you back in the studio. And I want to thank you for respecting New Brunswick's voters enough to take the time to discuss this really important issue. Let's start with a general question. First, I just want to get your reaction to the fact that the leader of the Conservative Party is not here tonight to have this conversation. What does that say to you?
It's disappointing. I think healthcare is the #1 issue that New Brunswickers talk to us about on the doorsteps, in the coffee shops. They're concerned. The system is failing us, and for the person who is currently responsible for the government and wants to continue to be, not to participate in sharing their ideas, talking about their record, I don't think it shows a lot of respect for the people of New Brunswick.
David Kuhn?
Well, it does reveal a lack of respect for voters and for people working in the healthcare system. All the leaders were at a panel discussion on the future of healthcare with the family practitioners not that long ago. And a family doctor stood up there and said, Mr. Premier, I have never felt so respected in my professional career ever until now. Extraordinary. I mean, you hear that from physicians, you hear that from nurses, you hear that from paramedics, you hear that from those people who are responsible for infection control and cleaning in our hospitals.
Respected or disrespected?
Disrespected.
Oh, disrespected, okay.
Disrespected. Yeah, disrespected. So that's why, fixing the healthcare system has to begin with respect.
Okay. Give us your assessment of the current state of our healthcare system.
Oh, I think our healthcare system is on life support. We see the toll that it's been taking on the workers in the healthcare system. When I talk to the support staff, nurses, doctors, nurse practitioners, as David listed, paramedics, everyone is feeling burnt out, feel like no one is listening to them as they voice concerns, as they voice solutions. They're not at the table when plans are being made, and they're really feeling like no one cares about the people who are caring for us. And so the system is crumbling under the weight of the vacancies, the lack of staffing, the lack of retention, and our healthcare needs are increasing. And so the pressure has built up to the point where the system is failing.
David Kuhn, your assessment of the current state of the healthcare system?
Well, unfortunately, it's in a downward spiral now. And I guess the best example of that is trying to recruit physicians, for example, to come to New Brunswick. They're going to call a colleague and say, what's the state of healthcare in New Brunswick? And they're not going to get a good report. So the only way we're going to really see an interest from healthcare workers who want to move here is if we've got a healthcare system that's got momentum, that is moving in a positive direction, that is actually restructuring in a way that reflects a 21st century healthcare system. And that's where we need to go, so that there's something exciting going on here that people are going to want to come and be part of and help build. And that's not what we've got.
Is the state of New Brunswick's healthcare system unique in the country?
I think it's uniquely bad. We've seen other provinces try some things to tackle this, neighboring provinces that have demonstrated a desire to retain the people in their healthcare system, keep the folks that they have, engage them in the process of building solutions. We've seen innovation and big actions coming out of places like British Columbia, and New Brunswick is at best taking half measures, but with no relationships to the people doing the work. David talked about what doctors are thinking about if they want to come here. We have a premier who said, well, if every doctor just took 2 or 3 more patients a week, everything would be fine. Well, having the leader of the province suggest that doctors just need to work harder is not a great recruitment strategy. It doesn't make people feel valued when they're delivering critical care to New Brunswickers. So I think it's been a challenge nationally and internationally, but New Brunswick is not taking the steps that we need to turn things around.
Okay, New Brunswickers wait almost twice as long as the national average for medically necessary procedures. And I just want to say that again, because when I first saw that, I thought that can't be right, but it is. New Brunswickers wait almost twice as long as the national average for medically necessary procedures. What would your government do to shrink those wait times?
Well, so it sort of breaks into 2 things. If it's procedures, you're talking about hospitals or basically hospitals, I suppose. So the number one issue with hospitals is we no longer have the ability, or the local administrators no longer have the ability to manage their hospitals. All of the different specialties and staff in the hospitals report up outside of the hospital to managers who work from a desk from afar. And it's a terrible system. So that the sense that used to be there before this was changed of being part of the same team, whether you were in charge of cleaning operating theaters, or whether you were a nurse or a nurse, practical nurse, or a security person, people, I'm told by those who've been working in the system for some time, there was a real sense of community, a sense of being on the same team, a sense of wanting to work together to solve the problems that would arise with a manager who had the ability and the capacity to make decisions working with their team. That's not how it works anymore. The management layer is removed, it's distant, it's away in horizon and vitalité, removed from the hospital, don't understand what's happening on the ground. Here's an example. Back in 2015, just after I was elected the first time, the chiefs of emergency medicine across many hospitals raised the alarm with government and said, look, the wait times are dangerous for many of the people in our ERs. Now we need to do something. Here's some solutions that we think would work. The government of the day failed to act on it. Victor Boudreau ignored it. I can clearly remember a question period laying this out, repeating what the chiefs of emergency medicine were saying from across the province, didn't act on it. And that's what we've seen for years, government after government, failing to act in the face of real problems when real solutions were being presented.
Okay, so there's an election, you're in government, what are you going to do to fix that? If it's a management structure thing, so what are you doing?
So we would bring authority back to the community, so that hospital administrators would manage their hospitals, so that the team would work together again across disciplines within the hospital. You would lose the silos, and we would actually create local community health boards to provide that community input into what's happening in the hospital and the rest of the local healthcare that's happening in health centers and clinics.
And how does that, I'm coming to you in 1 second, you're going to get the same amount of time, but how does that reduce the wait times?
Well, because if you can't manage what's happening on the ground with an understanding of what's happening on the ground, then the managers from on high can't solve the problems. They're not familiar with what's going on. They don't know the hospital. They don't know what kind of solutions are going to make a difference. If you're on the ground as a manager, working with all the people daily from the different parts of the hospital, then you're going to come up with solutions to the degree that you can locally before you have to reach out for more resources or what have you from the health authority or from the Department of Health. But it's that sense of local management, recognizing and understanding the local problems and finding local solutions, working together as a team in the hospital.
Okay, Susan Holt, what will your government do to shrink those wait times?
Well, we hear about the wait times because it's one of the most uncomfortable things, right? To know that you need a health procedure and you don't know when it's going to come, or worse yet, you're given a date and then it gets bumped.
Right.
And then that date gets bumped and you start to deteriorate. And even what we're seeing now is people aren't even showing up to the system because our hospitals have become the catch-all. We have failed to address the needs in primary care, so our hospitals and our emergency rooms are taking everybody in, which is why we find hallways full of people. We have beds that are full of people living in hospitals. When I was doing a tour of the hospitals around New Brunswick, I was in Stella Maris de Kent, a great little community hospital. There was a woman who had been living there for 3 years, waiting for a long-term care placement. And that means that that hospital can't process the surgeries that it needs to, because if you don't have a bed to recover in, then you can't get the surgery done.
And did you have a conversation with that person?
Well, I didn't at the time because she was not in a position to take visitors.
Okay.
And her story isn't unique. We have 443 seniors living in hospitals right now, and because they are, we can't move the surgeries through the system that we'd like to, because we haven't addressed the issue in primary care. So nobody wants to live in a hospital. Nobody wants to show up at an ER to wait for who knows how long to be seen for something that could maybe be seen by a family doctor or by a person in community. But our specialists don't have the tools, they don't have the spaces, they don't have the equipment, and they don't have the resources in our specialized healthcare centers to get those wait lists down.
So what's your plan? So how would you do that?
Well, we have to start at the root of the problem. You have to start with primary care. Every New Brunswicker deserves to have a healthcare home close to home where they can get connected care by the right people at the right time when they need it. So that primary care home has a team of people serving them, and those people are paid fairly and competitively and have the tools and the spaces to deliver great care to the community. If you do that, then you're taking the pressure off of the ERs so that they can do what they're meant to do best, which is a much more expensive form of healthcare. There's another piece to it,
Why
though.
is it more expensive?
To serve people in the hospital, where you have your specialists and your ER docs there to deliver life-saving care. If you're spending the night in the hospital, it's a lot more expensive place to spend the night than to go to your community clinic and spend the night in your bed at home. So that's a piece of it. We've got to deliver excellent primary care, and it has been neglected for years, and for governments and governments.
So how long would it take from the implementation of that strategy until people start to recognize that wait times are in fact becoming smaller?
I think you could turn it around pretty quickly, but there's another key part that has to come with it. So I talked about the inability to move people from a surgery to a bed. We need to invest in long-term care and make sure that we have staffed up our long-term care facilities with people who are, again, being fairly compensated. Their work is being valued, because if we can move folks from where they don't want to be, which is living in a hospital, to getting great quality of care in one of the long-term care facilities in New Brunswick. That's also less expensive, it's better care, it's closer to their family members, they get better outcomes. So delivering primary care takes the pressure off the ER, really staffing up and doing long-term care properly. And I know you know about this, you were part of Kelly Lamrock's long-term care team. If we can get that right, then the pressure comes off the most expensive part of our healthcare system, our hospitals and our acute care environments, and then those people can do the job they're meant to do quickly, and we can start to move through our surgical wait lists because we have beds for people to recover in, and we have the right people doing the right work in the right place.
Okay, the reality is, I think everybody would acknowledge, everybody who's going to the system for healthcare, the people who are working in the system would acknowledge that we don't have enough doctors, we don't have enough nurses, we don't have enough clerical workers, we don't have enough people to reprocess medical devices. If you look at the healthcare system as a whole, doctors and nurses on the front lines, but all the people who are supporting them, we don't have enough food services, housekeeping staff. What will your government do, David Kuhn, to find more people to fill these positions? And part two of the question, what is your plan for increased recruitment and keeping those workers here once we find them, the retention aspect?
So Terry, to fix the healthcare system, we're going to need a generational investment, an investment that we haven't seen made in healthcare for a long time. The solutions to the primary healthcare system were made back in 2002 by the Department of Health. Create these multidisciplinary healthcare teams, create community health centers, but liberals and conservatives failed to act, kept kicking it down the road, to where we are in crisis now.
Why was that?
So we need a generational investment. For one thing, they didn't want to spend the money. For another thing, it took a while, I think, for physicians to come around to the point where they take the view now that they need to work in teams. Younger physicians would rather work in teams, and the idea of a solo physician being the gatekeeper to the healthcare system is really going by the boards now. So I think whatever resistance might have been there back then has disappeared now. So that's going to be key. But people have to be compensated. They have to have good working conditions. And what we've seen in the last number of years is people bleeding out to Nova Scotia and PEI from the healthcare system because they couldn't get a permanent position, even though the need was great for filling vacancies, because they couldn't get anything equivalent to the pay they could get in Nova Scotia or Prince Edward Island. And the working conditions have been miserable here.
So is it just a matter of giving them more money?
Well, it's not just that, but to begin with, as I mentioned earlier, if in the context of hospitals, we go back to the system where local management happens in our local hospitals, there's real decision-making power there. The morale that will be developed around working as a team across the entire hospital, across all departments and all classes of employees, will be extraordinary, and that is key. That and the respect from the government that ultimately is in charge are the two things that are really necessary, I think, to create an environment where we can retain staff. Yes, people need to be compensated properly. People need to have safe working conditions, and neither of those things in many cases are the case. I'm tired of hearing how this position, that position, this position is the lowest paid in the entire country. That's where we're at, and that's why we're losing people. So we need to compensate people fairly. There shouldn't be any difference fundamentally between what we're paying healthcare workers, no matter what their positions in New Brunswick, from PEI or Nova Scotia. We're all basically in the same economic boat. We should be paying comparable salaries with comparable benefits.
Okay, I got it. So how do you determine what fair compensation is?
Well, let's look at what's happening across the region. That's for one thing. And then, of course, you've got to bargain in good faith with the unions representing the unionized members of the healthcare profession. And we certainly haven't seen that with this government. They're anti-union. The Premier doesn't seem to get the idea behind collective bargaining, and gives up on collective bargaining before the process is finished, and brings in legislation to get what he wants.
Susan Holt, on the recruitment and retention strategy, what is your plan?
Well, I'd like to start by flipping it, because it starts with retention. We have to show some respect to the workers in the system right now who feel invisible, who feel like they're not valued. And there's no point in recruiting in if you're just going to keep losing them. In order for us to increase the number of people we have working in the system, we have to keep the people that we have today. We have to show them that respect because they have ideas, they want to be heard, they want to participate in the solutions. But when you don't have the right people at the table in bargaining, when you're moving at a snail's pace, or worse still, when you're bringing forward something like Bill 23 that overrides free and fair collective bargaining, then
For
how are
people
folks
who don't know
supposed
what
to?
that is, can you just give us a brief summary?
Bill 23 was essentially the Premier pulling the plug on pension negotiations with different groups of workers to say, oh, we can't come to a deal, so we're just going to force you into a pension without respecting the fact that we came to an agreement on how this bargaining was going to go. So the Premier could decided to override that, and he's shown a disrespect to unionized workers time and time again. And so we have to start by valuing the people who are making sure that our healthcare system is supported, because retaining them is the first step to then building a system where we can fill the vacancies and recruit more folks.
Where are they coming from? But where are these workers? Okay, assuming that you have managed to retain the workers that are here and they're enjoying a different workplace, a different emotion in the workplace, where are we going to get the other people to fill the vacancies?
A couple different places. So training is a big piece of it. And we actually have people in the system today who would love to have access to more education so that they could build their careers and move up into a different role and contribute more, have that scope of skills recognized. They've been asking for support for educational programs that are flexible, because one of the things that our healthcare system is really missing today is flexibility. It's exceptionally rigid. As David pointed out, I've talked to healthcare workers who are currently part-time, but who want to go full-time, but they're in a part-time box and the system won't let them move. And someone who's working full-time who wants to shift to part-time, but no, they can't do that because they're allocated a full-time spot. And that inflexibility is seeing people leave the system who might return.
Where is that rigidity coming from?
It's coming from the Department of Health and the healthcare networks that have long set the policies and not felt like they needed to create the working conditions, the flexibility, the respect for people's lives, to give them the scheduling and the opportunities to work and to support their families and to get educated the way they would want. I'll give you an example that's been haunting me a little bit, because I was out door knocking on the weekend and talked to a retired doctor who wants to come back and contribute. Who wants to serve New Brunswickers, sees the healthcare crisis that we're facing, and was told he either had to take 1,200 patients or none. He wanted to take about 400. He was interested in serving about 400 New Brunswickers, but was told 1,200 or nothing, because that's the way that they had the system structured. If it wasn't a full panel of patients, you might as well not take any. Well, I know 400 people on a waiting list for primary care that would have loved the opportunity to have access to another doctor who wanted to contribute their skills on a part-time basis.
So what would you do then? What would you say to that doctor?
Well, that we can be flexible, that if they want to contribute some of their time to serving New Brunswickers with primary health care, then we can make that work. We can throw out the way we've always done things and respect that our healthcare workers need to be cared for, because they're not going to serve New Brunswickers if we don't create those conditions.
I mean, the system is not responsive in this way, right? I don't know how many people have contacted me, said I know a doctor who was trying to get work in Fredericton, for example, and couldn't get work because
A doctor couldn't get work in Fredericton?
Yeah, because health authorities said, oh, we've already got that specialty covered, we don't need you. So the health authorities are still really regulating how many doctors can work in a particular area, even though we thought that was gone by the boards and something out of the past now. So that's still happening. People will be shocked to know. And secondly, we need to be doing a real bang-up job of retaining the graduates from our nursing schools, from our medical schools, our graduates in respiratory technology and our other healthcare programs in this province, so that they don't, as many are, go off to other provinces to work, because it's better to work in those other provinces. Mm-hmm. Our system is going down, and they're going to go somewhere where that's going to be much more comfortable for them and perhaps more challenging.
But you would think, sorry.
Well, we should be offering a job to everybody who's enrolled in one of the critical healthcare programs in New Brunswick, so that they know that when they're done studying, there's a job there for them with a good income and a commitment to stability. We should do that and help them defray the cost of that education, right? We should be covering the tuition for people who are trying to fill a critical shortage in our system. It should be easy to decide that you want to train to become a healthcare professional because you know you have support for the educational costs, you know there's a job there guaranteed at the end of that, and yet we're not doing it. And so graduates are on the verge of graduating, crossing the stage, and are getting poached by neighboring provinces because we haven't been proactive in our recruitment.
I know someone that happened to. Ended up in another province nearby. So there are people watching us have this discussion tonight, and they're probably screaming at their
Frustrated,
TV sets, going, "Why is it that way?"
Oh, I mean, it's years of status quo. It's years of penny pinching, right? We had a lot of years of deficits and of having no money and looking for places to scrimp and save. And it happened at the expense of our healthcare system.
And management has become so centralized in the system now that it doesn't have the nimbleness necessary to figure out what's needed to retain healthcare professionals in this province. That's clear. It is horrifying to see how the sense of urgency has not been there to retain healthcare workers. How I know a young respiratory technologist, when she graduated, had to go to Yarmouth for work. She wanted to work home in New Brunswick. And eventually, after a number of years in Yarmouth, she managed to find a way home to work in St. John. But why does that happen? It should not happen.
Okay, so everybody is going to be going after those nursing graduates and the people who are graduating from medical school. Ontario's going to be going after them. Newfoundland's going to be going after them. What do we have to do? What would your government do to ensure that they come here?
Yeah, well, we have to get flexible and recognize their needs and priorities. Thankfully, New Brunswick is a beautiful place to live. There's lots we have
Agreed.
to attract people to this gorgeous province. But we have to show them that the pay is competitive, that their full scope of skills will be recognized. So everything they've learned in their training, they can put to work in our environment, because that's not the case today. And most people want to use the skills that they've just developed. We have to give them that flexibility so that they can have the work-life balance they want and know that if I want to work a little bit in the ER and a little bit in a community practice, that the system's going to recognize that and they're going to let me do those things. So we should be the most flexible, the most nimble, so that people who care for New Brunswickers get care from their government and feel valued.
So that's going to require a lot of money. Do we have the social license to spend that money?
We do right now, and unfortunately the Premier squandered some of the opportunities when he had these giant billion-dollar surpluses. I said we need a generational investment to fix a healthcare system. I'm hearing from too many people who are saying it can't be fixed. It can't be fixed, Dave. Well, what they mean is that government after government has failed to act to fix it, and they have no expectation that the government is now going to actually fix it. They've given up, and that's very worrisome when people get to that point. So our healthcare system can be fixed. We know the solutions. It's just that there's been a failure to act from government after government after government. So we need to have a commitment to act to invest that money to restructure the healthcare system so that it works for New Brunswickers.
But I think the reality is that every election, New Brunswickers hear politicians say, I have the solution to the healthcare system's problems. And they're elected, and for many people it doesn't change. So how much confidence do you have that you have the solution that is going to fix things?
There's no lack of solutions. We've known the solutions for a long time. The healthcare workers throughout the system have been bringing forward the solutions that will work, that need to be implemented. But those solutions, their ideas just keep bouncing back at them from management on high. There has to be a political commitment to do the necessary restructuring, to make the generational investment we need to make to fix the healthcare system for once and for all. And that's my commitment. There's
a big shift that has to happen, because politicians aren't going to fix it. The people who are going to fix it are the people who are in the healthcare system doing the work today. And so it's our job to be listening to them, to be bringing them into the process and making sure that they are designing the solutions that they will be then implementing. And that's something that the Higgs government has completely failed at. Their relationships with the very people that they need to be delivering this care are at an all-time low. To develop a primary care plan without engaging the people who deliver primary care, their behavior at the bargaining table that totally turns off everybody who's working in our healthcare support systems. It's not the premier's ideas that are going to solve this. It's what comes from the people on the ground. So we need to flip the model. Government can't make all the decisions in Fredericton and then tell people to act. We have to recognize that the needs are different in different communities in New Brunswick. And what the Stella Meadows de Kent Hospital looks like is pretty different from the Waterville Hospital. The needs at the DEC are different from the needs at the Caracat Hospital. We need a hybrid OR here in Fredericton, and the DEC is ready to go with that. And yet we have a bureaucratic system that doesn't recognize local needs or listen to those voices on the ground. So
That was a political
it takes someone like our team, a team approach, to engage, listen to, respect the voices of the people doing the work, and have them be the ones driving the solution, because they have the ideas, they have the solutions, and it needs a government to say, hey, we're going to listen to the folks on the ground. We don't need to take ownership of this. It's not going to be our ideas. The people who listen and collaborate and build those relationships, that's the government that's going to do best by New Brunswickers.
But if it's a bureaucratic impediment to fixing up the Chalmers, why would you let those people continue to make the decisions?
Well, that's exactly it. We should be listening to the folks who are delivering the services at the Chalmers, at the St. John Regional, and listening to the fact that the Horizon Health Authority said we need these hybrid ORs in all of our hospitals, actually, in Moncton as well. And so why the minister has to get involved and say, no, I'm sorry, at the DEC you'll have to wait until we get the retrofits done somewhere else, even though you have the space ready, you have the funds ready to be raised. It becomes political when it should be driven by the people on the ground who know what kind of care we need and the folks that are responsible for those systems.
You can't do that unless you empower the people on the ground, and that's what we would do.
So specifically, how would you do that?
Well, we need to restructure the way things are managed. There's too many layers of managers inside the regional health authorities, and they're managing from on high.
Are we getting rid of managers?
No. Well, we might get rid of some, but we need to move some of that authority down to local management, which they do not have the authority to do much of anything anymore. Just look in the greater Fredericton region, health region, on the primary care managers, it's been a revolving door. One person after another, after another, after another has been manager of primary care, and now primary care for the Fredericton Health Region is being managed on the interim by the St. John primary care manager, who covers St. Stephen to Sussex, and now she's got this massive chunk of the province to be in charge of primary care. She's great, but she cannot handle this huge area. It doesn't make any sense. So these are the kinds of structural problems that exist at the management level right now. People are going to say, just fix it. And that's what I would do, is just fix it.
Just fix it. Okay, I want to shift gears a little bit. Our healthcare system is vast. It relies on multiple skill sets beyond what doctors and nurses are providing. What would your government do to make sure that we are getting maximum benefit from all of those other workers?
Well, that supposes we're not getting maximum benefit from those workers now. Most of those workers are what are holding the healthcare system together now through sheer force of strength and grit. The workers in our hospitals, the nurses, the doctors, the entire staff, the respiratory technologists, the clerks, the security people, they are holding it together really now, and they can't hold it together much longer. They're working crazy hard, and so you're not going to get any more out of those people. They're burning out and they're leaving. So we're getting more than the max. I mean, we are getting so much work out of the team of healthcare staff and professionals in our system. It is mind-blowing what they've been able to do to hold things together, but they can't hold on much longer without a major intervention from government.
Do you want to try that?
Well, I think it comes back to what we've already been talking about, is respect for the conditions that they're working in. If you look at somebody who's doing admissions at the hospital, they are seeing people churn in, often at their worst. And that person is the one who knows what they need to do better at their job, to be more efficient, to serve the patients better, because they want to. Every time I've gone into a healthcare facility and talked to the people who are serving, they care very deeply about the services that they deliver, and they see their roles as really important to the whole system working properly. And so they have a perspective to share, and they need to be respected and listened to, because they know best what's going to make their job go better and what's going to make their working conditions easier, what's going to help them serve patients better. So it's a matter of listening and showing respect to those folks, and then actually implementing the ideas that they say will make a difference.
So how does that happen, though? How does that happen in the real world on the ground? Do you have a consultation process? What does it look like?
Yeah, you've got to get out of the building. You've got to get out of the bureaucratic offices and build those relationships with the people doing the work on the ground and the folks who represent them, because they're trying to offer those solutions today. Thank goodness that Norma and Trent and team call us to say, here's the problem, here's an opportunity, here's the solution, right? Here's how we want to move forward.
These are union representatives that you're talking about.
That's
now.
right,
Okay.
that's right. They do an excellent job of raising the issues, because they're with their members all the time. They're in touch. They know what the issues are. They're doing that work, but they're falling on deaf ears. There used to be a labor table that existed under the previous government that was a regular meeting of labor leaders and the government to talk about issues, to find solutions to problems.
Was it effective?
It was effective. We've been hearing now that it's sorely missed, because the relationship and that building of trust really matters. Then you can have good information flow, and you have to have a government that's willing to get out of the way and doesn't need to take credit, isn't sitting there hiding the information and thinking, no, we know best, because we've seen that. We've seen some piece of data that's influenced some leader somewhere, and that's not giving them decisions informed by the people doing the work. We really just, it's almost as simple as building the relationship and caring about the people who are delivering care, which means listening to them and acting on the solutions they recommend.
Okay, I just want to switch gears a little bit. I'm going to give you a chance to tell the people who are watching what new and innovative policy decisions you would implement if you were in a position to form government.
So one of the important things we need to do is contribute to a healthier New Brunswick. We need to place a greater focus on preventative health care. So we have fewer sick people. We have one of the highest rates of chronic diseases in this province, in this country. We have one of the highest rates of disabilities in this country. We need to really include in the healthcare system a strong emphasis on prevention. A lot could be done through the schools in terms of working with the students to help build healthy eating habits, exercise, get into that
Lifestyle
habit early
changes.
on, all of that, as well as addressing some of the other determinants of health, environmental determinants of health, like radon in people's homes, which is being, public. I don't know why public health is not all over that.
Just sent my test in yesterday.
Good, but we need to rebuild the public health system to be able to help deliver on preventative health care in unison with the primary healthcare system, with doctors, nurse practitioners, and other health professionals, that was ripped apart by the former Liberal government after they fired Dr. Cleary. They broke up public health and passed it all over government to different departments, which truly undermined the capacity of public health to do its job, to do preventative health care. So really, a key is to reduce the number of people who actually need treatment, that need to go to the hospital, that need to go to the community health center for treatment, that need surgeries and what have you. We need to build a healthier population through preventative health care. There's a great example, Queens North Community Health Center in Minto. So that's a great model for where we need to go. It's excellent. They saw that people that they were treating would be helpful if they were more active. What did they do? They built trails around the community health center through the woods, bought snowshoes, and organized regular parties outdoors with fire pits and hot dogs and all this to bring families out to go snowshoeing, to play around in the snow, to get active. That was the community health center that did that. That's where we need to go.
Okay. An innovative healthcare policy that you would implement.
Well, I think it's actually quite a simple one, but I think it would make a huge difference in people's lives because people want to get access to care when they need it. Sure. Not when after they've successfully gotten through and called and called and called and called and finally got an appointment to come during business hours. We need those community healthcare clinics to be open at 7 o'clock in the morning and at 7 o'clock at night so that I'm on my way to work and can stop in, or I've picked up the kids from soccer practice and can stop in, which means we have to pay after hours care the same as we pay regular hours care. Right now we pay for it at about half the rate that we pay for an office visit. So guess what? Nobody's delivering after hours care. And most people work during the day and need unusual times to access the healthcare system. But our compensation model discourages after hours care. So I think we could make a huge difference in people being able to get access to the care they need when they need it as quickly as possible to address some of the preventative pieces that David Kuhn talked about. And then you have to pair that with the technology so that if I go in at 7 o'clock in the morning and it turns out that I need something, information about my healthcare situation can move from healthcare professional to healthcare professional to healthcare professional in a seamless way that means that I get really timely care, the best care possible. I'll give you an example of that because it's really broken right now. If you have a paramedic show up at your house, they likely have very, very little information about you or what's going on with you other than what came through the call.
Right.
And then they assess you, they get good information about what's happening, and maybe they take you to the hospital. They don't have a way to transfer that data to the surgeon or the specialist or whoever is going to see you at the hospital, who then decides, actually, we're going to have to send you to St. John. And they don't have a good way to send information to St. John. There's faxes happening, there's phone calls happening, and then you get sent back home, and extramural's gonna come and see you. And they don't have the information. So we have to connect all of this data with a real clinical healthcare system that means that the people who are delivering care to you know what's going on, and you're not waiting for a fax machine, and you're not wondering what's going on. Someone's not asking you those same questions again and again and again. You're filling out the same forms time and again, only to get referred and to have to tell your story again to another healthcare professional and relive the trauma. If we had care in community at the hours that you needed it and then could connect the information system so that you didn't have to tell that story a million times, I think that would really change how New Brunswickers experience healthcare in this province.
I think I can hear applause. I think I can hear people applauding. Here's a big question. Are we financing our healthcare system adequately?
No. New Brunswick spends less on healthcare per capita than almost every other place in the province. Even though we are older and we are less healthy, we spend less, and so no wonder our health outcomes are terrible. And we have 100,000 people waiting for primary care in New Brunswick. We have 1,000 seniors waiting to get access to long-term care in this province because it is underfinanced and has been for a long time. We see it when the health authorities were asked what they needed to make transformations in primary care. They said in the next year, $50 million. And what did they get? $20 million. So guess what? That's a half measure. We're never going to get there if we can't even fund the plan to transform primary care at half the level that was requested by the people that are supposed to be delivering it.
But, okay, so let's say you're premier. Are you just giving them whatever they ask for, whatever they want?
I think that there's been some good recommendations come forward by the folks who are on the ground delivering the care. We saw estimates from the Medical Society of what that might cost. We even saw Jane Philpott, who wrote a great book that says for about $500 a head for every Canadian, we could make sure that everybody has access to good primary care in this country. $500 a head. So I think the key is to switch it, because as I was talking about earlier, if we can give people great care in community, primary care at the hours that they want, then we're going to see less and less people waiting at the ER for that care where it's more expensive. So you actually get savings over the medium term by just moving the investment to the front of the problem. You save costs on the other side of the problem. You have to do the same on long-term care, right? If we address those two big elephants, then the costs go down in that acute care environment, and you can balance it out.
Okay, David Kuhn, same question to you. Are we funding healthcare adequately?
Well, clearly not. As I've said, we need a generational investment in healthcare to fix the problems. And if we want to have multidisciplinary healthcare teams where doctors and nurse practitioners and nurses and dietitians and physiotherapists and so on work together, there needs to be a funding model to make that happen. Doctors can't pay for all those people out of the income from their practice. So if you've got a multidisciplinary healthcare team in a family practice, we need a funding mechanism to compensate those people. But we also, I mean, the things that stick in my head too are where penny pinching has happened to the detriment of the system. And here's an example. After Brian Gallant was elected, the folks who clean our hospitals, the Union Local and some of the members came to see me and said, we've just been given crap cleaning materials, crap detergent. It's not effective. We're supposed to be ensuring the hospitals are clean enough so that
There's a disinfectant property there too.
We're controlling infection. So we're supposed to be disinfecting the patients' rooms, operating theaters, and so on and so forth. And yet, to save money, the quality of their cleaning equipment and the quality of the cleaning materials was reduced. That doesn't make any sense. But it seemed like something at the time, apparently, that they could dispense with, without thinking through the role that those healthcare workers play in the hospital in terms of ensuring good health for the patients, that is, infection control through good cleaning.
What is your position on the role of the private sector in our healthcare system? How much are you willing to accommodate?
We're seeing way too much privatization already. It's expensive. We saw the Liberals privatize the ambulance service, and they had a chance to bring it into the regional health authorities when renewing the contract. They didn't do it, but what they did was privatize extramural and add it to that private system run by Medivie Blue Cross. Now the Conservatives have hired Medivie Blue Cross to start delivering primary health care in primary health care clinics. So we have private primary health care clinics managed by Medivie Blue Cross, like in Fredericton here, right in the Superstore, which the CEO of Horizon is telling me she is scared to death, and it's already beginning to happen, that they are removing staff from the Horizon system into the private system, competing with them. To enable Medivie Blue Cross to meet their contract
Run that
obligations.
by me again.
Medivie Blue Cross, and this government's plan is to make this a permanent thing. Medivie Blue Cross is running privately managed clinics, employing publicly funded physicians and other health professionals to take on unattached patients, right, across the province, and it's called MB HealthLink, right? And so this private company now is essentially poaching time from the hospitals and clinics that health professionals should be providing there into the private clinics.
And what's the benefit of that?
And well, the benefit is that Medivie Blue Cross will be meeting their contractual obligations to the government who are paying them to do this. This is a very, very expensive way to deliver primary health care, and it needs to stop. It needs to stop now.
Okay. Susan Holt, your thoughts on private sector involvement in the healthcare system. How much are you comfortable with? Are you comfortable with any?
No, we need a strong public system. The growth in the private healthcare system is because there's been a failure in the public healthcare system, but we need to make sure that we have fixed the public healthcare system. We wouldn't need private solutions. They are more expensive when every New Brunswicker should have access to public healthcare and have the same access regardless of their means or their ability to pay. That's a tenet that we hold pretty dear here in New Brunswick and in Canada. So we have to make sure we are delivering the best possible care, and we can't see that poaching of talent away to private systems that end up costing everybody more.
Okay, so you find yourself in government. Are people still paying for MRIs, still paying for blood work instead of waiting in the public sector line?
Well, hopefully not, because we will have fixed the public sector line, right? I can understand the instinct. If you have to wait hours, days, weeks to get service here, and you could go over there and get it much more quickly, I can understand why you'd want to do that. If we fix the public system so that you're not waiting weeks to get that service, then there won't be a private opportunity to deliver something different. It's our job as a government to deliver good public health care that everyone can access in a timely manner. And if we do that, then the private opportunity doesn't exist anymore.
Okay, it's amazing how quickly an hour goes by. I want to talk about emergency rooms, because I think for many people that is their point of contact with the healthcare system, if they're lucky and if they don't have a doctor. And even if you do have a doctor, sometimes that's your only option. I get the sense that public confidence in our emergency rooms is extremely low. What would your government do to restore public confidence in emergency rooms?
Immediately make sure our hospitals have wards, temporary wards, however we can provide them, to move people out of the ERs who are blocking exam rooms for those people who are waiting in the waiting room, and put them in that temporary ward while they're waiting for a bed in the hospital. So they're not sitting and this is what's happening now, they're sitting in exam rooms, they've been seen, they're going to be admitted, they're hooked up to equipment, and the exam room's not available for people waiting in the waiting room, the equipment's not available for people waiting in the waiting room, and so it's clogged. And so we need to create temporary wards that is kind of like the in-between space where you go after you've been in emergency, you're going to be admitted before you get a bed on a ward. That's an immediate thing.
Does that work anywhere in the country? Is that in any other jurisdiction?
Well, that's what, for example, the chief of emergency medicine here in Fredericton is saying he needs now, and it would make a difference, because he's got to get people out of the exam rooms to unclog the emergency room. And this is serious because, as we know, people have died in the Fredericton ER waiting room, people have died in other ER waiting rooms. Exactly what emergency medicine chiefs from our ERs had told the government back when Victor Boudreau was health minister. This is going to happen unless we fix this problem. And the other end of it, of course, is the seniors who are having to live in hospitals, occupying beds, and they must feel so bad about doing this, but what choice do they have right now? Occupying beds that should be used for acute patients that are being admitted. We need to move them out of the hospitals into appropriate care. And that means fixing the special care home costs so they're affordable. In St. John, I know, for example, there are seniors who could be in a special care home if they could afford them, if those special care homes costs were capped like nursing homes costs are capped.
And you're comfortable with the private sector involvement in the long-term care?
Well, we've got a kind of a duality there. So we've got community-based nonprofit nursing homes, which do a tremendous job. And then Liberals and Conservatives both have decided that they're going to favor corporate long-term care homes. And so we've got many more of those than we used to have, and are biased in the way the system is set up against the community-based nonprofit nursing homes, which to me provide a great level of care, attract volunteers, provide a very different environment than the corporate homes. And so we would prioritize building out and supporting those nonprofit community-based nursing homes.
Okay, Susan Holt, on restoring public confidence in our emergency rooms.
Well, I'd like to speak to what Mr. Kuhn suggested, because I've toured around the hospitals in New Brunswick, and there is no space for temporary wards when the Higgs government has people in hallways on every floor. We have people overflowing from our spaces, and so it would be lovely to create a temporary ward, but that space just doesn't exist. We have people crammed in every nook and cranny of our healthcare system right now. And so what I hear from the folks who are working in those ERs is they want to see more anesthesiologists to help with the workflow, because that's one of the bottlenecks. But ideally, they don't come to the ER in the first place, because we've created that community healthcare home where someone's going to show up there instead of at the ER, because the ER isn't the place to be delivering primary care. That's what you should be getting in community from a team of people who are the right people to serve you, and we could be doing that tomorrow. That's not a solution that's going to take a long amount of time. The government has to say, we're going to offer the administration, we're going to support the space, we're going to put the compensation model in place that works for you, and we have people who would say yes to that practice model tomorrow. But this government has refused to act on that. So the best way to reduce people's challenges with the ER is to give them good health care in their community by the practitioners that want to do it. If we could just take the admin burden off their plate, and then we can staff up our anesthesiologists and move people through the ER in a proper timeline.
The other thing is we need to provide, more urgent care clinics. So they've had this in St. John for a long time. They have this access at the Minto Queens North Community Health Center. An urgent care center was opened over in the north side of Fredericton 3 days a week now. But they need to be open, at times that people need them, not just 3 days a week. And that way people can miss the ER altogether and go to the urgent care centers and be triaged from the ER to the urgent care centers. What if we had a doctor, when you come into the ER, right, who you see right away, dedicated
So
to those
the doctor's
patients.
doing the triage?
And so, with the nurses, and so the doctor then would see that person after the nurses have done the triage and say, okay, you're going over there and you're staying here. You're going over there and you're staying here. And that, if you had a doctor dedicated to that, because we don't have, like in our ERs, we are short on doctors.
Right.
And so if you had a doctor dedicated to helping to ensure that those people who didn't really need emergency medicine went to, if there was a full-time urgent care center, went over there, and it should be adjacent to the hospital, that would address it. That's would be a big step forward, as would having an additional doctor at night in hospitals like the Chalmers, where we only have one doctor on the night shift.
Wow. I was wondering, is this hour going to go by quickly, or is it going to take its time? No, it's done, and I want to thank you both for taking the time. I know you both have long days, so to come in here tonight to talk about this issue, much appreciated. Thank you very much.
It was a pleasure.
Yeah, thanks, Terry.
I would like to thank Rogers and producer Jeff Dupre for their assistance in broadcasting this discussion. I would also like to thank CUPE Local 1252 and the more than 9,000 healthcare workers it represents for making this discussion possible. And thank you to everyone who is watching this now or who will watch it later on. We appreciate the fact that you take the time to hear this kind of public policy discussion about an issue that matters so much to so many of us here in this province. And with that, good night from the Rogers studio in Fredericton. I'm Terry Sege. Good night.